much, Mr. Chairman, and thanks to all of our witnesses for their very illuminating testimony. There's been tremendous innovation in the machine learning and generative AI spaces in recent years, and the healthcare sector really can see the potential benefit of this innovation. All of you gave excellent examples of how this can happen. One thing that struck me, Mr. Toy said that AI should assist doctors, not substitute for them. And I think all of you are nodding, so I think none of you disagrees with this statement, and we all agree with that. So Dr. Mello, I want to ask you, you testified that the uptake of the innovative tools is low, in part because of a foundational trust deficit. Is that right?
Yes, Congressman.
So in general, how would you characterize the evidence base supporting the use of novel AI tools?
It's thin, and what we have predominantly comes from the people selling the technology.
And I also suspect there are not well-established industry-wide best practices for the use of AI tools in the health space.
We have best practices emerging. The difficulty is why adopt them if there's no incentive or reason to do that?
To use them. And at present, which types of institutions are able to measure the impact of AI tools and to optimize their use?
The ones in the best position to do that are the ones with the most money and the most scientific expertise.
Right. So is it likely that institutions with fewer resources are going to be able to pull off that sort of robust evaluation and thoughtful implementation in the current environment?
I don't believe so. Certainly not with help from the reimbursement improvements that would enable them to staff up and gain that capacity.
Right. So those organizations with the fewer resources that we're talking about, like rural hospitals, community health centers, and other healthcare providers, they all serve our constituents. They're facing tighter and tighter resources to do their jobs. And as all of you know, and of course my colleagues here know, earlier this summer, H.R. 1, which I call the big bad bill, was signed into law. What that bill will do, it will kick 15 million people off of their insurance. So that's 15 million fewer people who are going to benefit from an AI revolution in healthcare. And hospitals who need resources to care for our constituents and to work on improving care, including with new AI tools, are facing an additional $400 billion in uncompensated care over the next 10 years. So all told, H.R. 1 is slashing over $1 trillion from our constituents' care. I've got to say, this is what I meant when I said in my opening statement that we're fiddling while Rome burns. All of us agree AI can really work, it should be used, we should use best practices, but when we're taking away the money to treat our constituents, then the idea that somehow they're going to find a way to do a robust and appropriate AI system is a dream at best. Impoverishing the healthcare system is just not going to help these improvements. And there's no, as we all agree, there's no AI solution that can replace the doctors and nurses that hospitals, which will serve the poorest Americans, can no longer afford to employ. And I want to say, this committee just simply has to stop acting like it's business as usual and ignoring the real problems that are facing our healthcare system and our constituents. If we really want to use AI as a good tool, we're going to have to reverse the cuts to Medicaid before they take effect and devastate millions of Americans. And we're going to have to stop the administration's damage to our public health system before the emergency lays open our vulnerabilities. I mean, this is really serious. I would like to be able to find a way to do some innovation at the FDA. I did that in 2016 with Congressman Fred Upton, then Congressman from Michigan. We did 21st Century Cures, which restructured a lot of things we do at the FDA and the NIH and the CDC. And it enabled us to have Operation Warp Speed, which I guess now the president doesn't like, but which saved millions of lives with the COVID vaccine. So I would like to be able to help spearhead a bipartisan effort to put the protocols in place and the funding in place at the FDA to do it, to do artificial intelligence. Folks, that's not where we are right now, and people better know that. I yield back.